You don't ever really, truly relax, and you're always ready for the next big thing to roll through the door.
In the ambulance bay, paramedics are rushing in Dr. Michelle's next patient, 55-year-old Matthew, who was found unconscious outside a local library. Matthew, a DJ, has been revived several times by the paramedics after going into cardiac arrest.
We've got adrenaline if we need while we're getting all that sorted.
Definitely make sure we're hooked up to our defibrillator.
Yeah.
Our priorities are making sure that his heart continues to beat, and we're also at the same time really concerned about his breathing. Do you want to manage airway?
Yeah.
Okay. Because if we can't get the oxygen in, then it's useless getting the heart to pump.
Are you going to help me with airway?
Yeah.
Dr. Luke De La Rue will take charge of Matthew's breathing and oxygen levels.
Almost as life-threatening as you can get if your heart's currently stopping.
Is that the patient? I was not expecting that.
Just relax, arms down for me. My name's Luke. I'm one of the doctors. I'm going to take good care of you. You just need to stay nice and still and in the bed.
Matthew's agitated. He is screaming and yelling, and he's confused, which could be a reflection of the lack of oxygen that's gone to his brain. Unknown downtime, was found unconscious.
Okay.
Then ambulance came, shocked him, gave him 3 further shocks that brought him.
You're okay, mate. Big breaths.
I think priority we need to secure his airway because we can't have him like this.
Let's go pads, then monitoring.
With all cardiac arrests, what we worry about the most is the brain. When the heart has stopped, if not enough blood or oxygen has reached the brain for a sufficient time, then that can cause irreversible brain damage.
Sarah, I'll scribe an airway.
Straight on airway.
Yeah.
Yes,
Procedure.
Good.
Across the corridor, emergency nurses Sarah Thomas and Jess Chapman are setting up another trauma bay for an injured mum-to-be.
There's been a car accident involving a young female, and she's 29 or 30 weeks pregnant. We've been told that her heart rate's quite elevated. Primary concern is that they've got a bleed somewhere, they're bleeding internally.
34-year-old Larissa was on her way to her doctor for a pregnancy checkup when the car crash happened.
Hey, my name's Jess. I'm one of the nurses. I'm going to be holding your head, okay? And then we're going to slide across it, okay? You just stay nice and still. 1, 2, 3.
A car accident is just so violent to the body, and when there is damage to the placenta, it can release hormones that can induce labour.
Just pop your blood pressure cuff on your arm. We're going to be coming at you from all angles.
Straight away, the trauma team examine Larissa and her unborn baby.
We can do things concurrently. So with the ultrasound, we can check the heart rate of the baby and make sure that the heart rate is at an acceptable level and that there's no signs of fetal distress.
One is trauma call because she's tachycardic at 120 with a sinus attack.
Larissa's heart is beating faster than normal, which could be a sign of shock or internal bleeding.
Hello. I'm Sarah, one of the other nurses. Having a bit of a shitty day, huh?
Yeah. It's always really good if we can kind of find some common ground that we can use to build a rapport. Definitely being a mum helps with that.
First baby?
Yeah.
Boy or girl?
Little boy.
Oh, I've got a little boy. But little boys are great.
Just worried about him.
And you just let us do all the work, hey?
As Larissa waits for the results of her ultrasound, news comes through about a seriously injured patient being treated next door.
He's a driver in the same accident. The rear-ended, yeah, the partner.
As in husband?
Yes. Yeah, he was driving.
Oh no. Oh, you poor thing.
Is he okay?
You're okay, mate. Just relax, arms down.
In Royal Melbourne Emergency, Doctors Michelle Thornhill and Luke De La Rue are trying to save 55-year-old Matthew, whose heart keeps stopping.
Just relax, big breaths.
It's critical to know as best we can how long somebody was in an arrest for. If they were down for just 5 minutes or less, we could continue this resuscitation and still hope for a positive outcome. If they've been down for more than half an hour, we know the chances are very slim to none. When you're ready, go ahead.
Matthew is struggling to breathe.
His prognosis is even more dire than we thought. If we can't get his oxygen levels up, he's not going to get the oxygen he needs for his brain. I think if you could have a look at his heart while they're preparing for intubation. Thank you.
Senior emergency doctor Martin Dutch joins the team to help with Matthew's intubation.
So we're really getting great views through there. There might be blood outside his heart compressing it. It might be dilated because there's a big blood clot travelling to his lung. No matter what the cause, your heart stopping is almost always fatal.
We have oxygen sats 87. It'd be great to optimize that oxygenation if we can.
We're going to get set up the tube now.
Okay, yep. All right, he has the drugs for intubation.
Matthew's sedated so a tube can be put down his throat to take over his breathing.
So we're not able to really get his oxygen any higher. Okay. The most worrying thing is the lack of oxygen circulating in his body. Muscles are dying and his brain is suffering. So it really decreases his chances of survival. Okay, so where are we at with airway?
We're good to go.
Yep, good blood pressure. Happy for you guys to proceed when you are.
But Matthew's oxygen level is dropping.
We immediately start thinking about what we can do to get those oxygen levels back up as best we can.
Sats are 87%. Sats are 86. Sats are 80%.
Sats are still dropping.
What have we got this time? Allergic reaction.
Senior emergency doctor Jonathan Papson has known his next patient for more than 20 years.
In general, doctors and nurses make pretty good patients because they know what's going on. They know what to expect. And how long ago did you get bit?
45 minutes ago.
In the treatment bay, senior nurse Randall Britton has come to emergency after being stung by a swarm of bees.
So you're covered in an urticarial rash.
Yeah. That's what made me think I should come in.
Randall knows the symptoms of an allergic reaction. He's worked at the Royal Melbourne for 25 years.
So Randall's a friend. He's one of the top nurses at RMH. He's been here even longer than me, which is a really long time. It goes way back to like last century and beyond.
You can feel wounded.
Yeah. Randall's having an allergic reaction, but when you get abdominal pain and nausea or tingling lips, it starts to put it in a more serious category. It's got a whole body reaction. It's got an anaphylactic reaction going on, which is much more dangerous. Have you got any other health problems, just ordinarily?
Yeah.
You on any medicines or anything? No. Thank you.
Nurse Randall's inaugural honey harvest has landed him in emergency as a patient.
I've got a home beehive, and my wife and I were doing our first harvest. We're going to steal some honey, and I got stung. So, somehow or another, some bees managed to get in my veil, and I got stung in the ear and stung all over my face. My wife got stung too. Once they start stinging, they're stinging everything.
It isn't the first time Randall's been stung by his own bees, but it is the most severe.
I got stung last week on
Yeah. It's the same beehive. Yeah. It may just be the load of bees. You know, sometimes you get many stings.
Yeah.
People die every year from anaphylactic reactions to bee stings. Randall's been stung by multiple bees, so he's had a much higher dose. If the reaction continues to get worse, your lips swell up, your tongue swells up, you can't breathe, and that can be fatal. So it can go either way. So you've got the cutaneous manifestation. You're tingly around your lips. Yeah. I am adrenaline that I'll sort you out. Let's do that. I'll give you some adrenaline.
An injection of adrenaline can have some serious side effects.
Well, I had adrenaline once about 30 years ago. I didn't like it then, so I'm not looking forward to it now.
Just worried about him.
Back in Trauma Bay 1, anxious mum-to-be Larissa is having an ultrasound to look for her baby's heartbeat.
Is he okay? The rapture itself is fine.
There's a wonderful heartbeat there.
Thank you.
34-year-old Larissa was in a car crash which may have injured her unborn baby or brought on early labour.
It's showing us that the baby's heart rate is within the normal ranges, which is very reassuring for Larissa. It brings a sense of relief, not only to the mum, but also to us in the room.
This is the other person in the vehicle.
Next door, Larissa's husband Jake has suffered head injuries and is being treated by Dr. Miriam Yasser.
Is a partner with a depressed skull fracture, so we'll see what it is.
Jake was driving and hit his head on the steering wheel when the car crash happened.
Head injuries are often very common, especially if there's no airbags or, if their head hits the window or the steering wheel.
Open your eyes for me. Look to the left. Is that sore? Look
Not
to the right.
really.
Look to the right.
It hurts when I go to the right.
Okay, look over here. That's sore?
Yeah, more
Okay.
like a, yeah.
Look over here. That's sorted out.
Yeah.
Open your mouth as wide as you can. It's sore to open your mouth?
Yeah.
Okay. Sorry.
Got some very nasty fractures which involve his eye and around his eye, and so his vision becomes a hugely important concern.
The first-time parents were on their way for a pregnancy checkup when the crash happened.
Given the mechanism of your accident and the injuries that we can see, we're going to be doing a scan of most of you, so your head, your neck, the facial bones.
Yeah. Is my wife and our baby okay? Just fearing the worst.
Apart from him having his own injuries to deal with, the one thing that I really am aware of is, the shock of being in a high-speed accident, the shock of having your own injuries and then not knowing what's going on to a loved one or your baby is, it's terrifying.
Andrew, that's his partner in there.
Yes.
Can I just give him an update? Is she okay?
Tell her it's all fine.
She's all right, and her baby's fine.
Yeah.
Thank you. Hey, Jake. I've just had a chat to the doctor who's looking after your partner next door.
Yeah.
Baby's fine, and your partner's okay. You okay? Oh, it's just a relief? Okay, everything's fine. Just take a minute to process all of it, okay? You're all right. You're okay.
The relief was there for me as well. I think to be able to break some good news. I mean, it is not always the case that we have good news to break in an emergency department, and it is just lovely. It is just the nicest thing to be able to tell him that things are okay.
But Jake faces some serious issues with his injured eye.
Your job is just to stay pain-free and lying flat on your back until the results of your scans come through.
Yeah.
I'm worried. Has he caused so much damage to the eye that it's going to be irreversible? I mean, with eyes, you just don't want to mess around with them.
So you have a fraction, okay? Thank you.
In Royal Melbourne Emergency, first-time parents Larissa and Jake are waiting to be reunited after a car crash.
We're gonna change that collar to a bit more comfortable one, yeah, I reckon.
27-week pregnant Larissa is in danger of going into premature labour. Her husband Jake has a serious eye injury and possible head injuries.
Sarah, I've already updated him on his partner, so he knows.
How's he doing, so I can update her?
So he's just going to have a scan.
Just a CT brain or full?
No, he's going to have a full.
Cool, I'll let her know.
Thank you.
I've just spoken to the doctor. They're going to do a bunch of scans and then see what the actual damage is and then see if it needs surgery or not. But I'll keep you updated, and if I can wheel you in there if you wanted to see him, I will.
Okay.
All right. He does know the baby's okay.
Thank you.
As soon as we can get her in there and let her see her husband, we most definitely will do that. Love your ring.
Thank you.
It is a gorgeous ring, isn't it?
It's beautiful. Good job, hubby.
Very lucky.
Larissa is going to the CT scanner ahead of Jake because of their unborn baby.
Before we can let Larissa move around and get out of bed, we need to make sure that her spine's clear.
All you need to do is stay as still as you can and see what's going on.
Thank you.
It tugs at my heartstrings a little bit more because I just know how vulnerable I was when I was pregnant. And then for something like a major trauma to happen, it's quite scary. And then when you've got your husband in the bed next to you, it's scary. You all right? Yeah. All done? Is that a bit better? Yeah.
The CT results have come in for Larissa.
Her scan results came back and everything looks really good. We're still monitoring the baby with the CTG monitoring on her tummy, but the doctor is organising a bed for her over at the Women's, which is just next door.
I'm okay because we've been in good hands, so yeah, still feeling okay. I'm probably just more worried about Jake at this point.
Jake's injured eye is very worrying for Dr. Miriam Yasser.
We need to get him to the scanner to assess the extent of the injuries that he has. Any damage to the eye itself, and then any potential injuries to his brain and to his neck.
Dr. Miriam has an update for Jake, who's resting to protect his eyes.
The result of that scan came back and it does look like you've got some fractures around that left, the bone that surrounds the eye. And one of them is pressing on one of the muscles that moves the eye, which is why you're getting that pain. So we've got specialists that have a look at fractures of the face. So we will have a chat to them and see what they recommend, okay?
I think given the extent of his fractures, there's a very strong likelihood that Jake is unfortunately going to have an operation. It is too early to appreciate if there's going to be any long-term limitation in his vision. Your spine's fine, so I'm happy if you want to sit up.
Oh, yeah.
We'll take this one off here. I think your partner's still in the bed next door, so have a chat to her, that's okay.
Hey, mate. Is it okay if she just... Oh, awesome.
You're so worried about me. They're going to take me to the Women's to monitor him.
Yeah.
His heartbeat's fine.
Yeah.
Likes high adrenaline.
Yep.
I'll give you some prednisolone as well, Randall.
Senior Dr. Jonathan Papson is prescribing a shot of adrenaline for workmate Randall, who's come in on his day off after being stung by his own honeybees.
He's having an anaphylactic reaction, a serious reaction to the multiple bee stings. He fits the criteria for adrenaline. He's getting it to turn off the reaction. Otherwise, the reaction's going to get worse. Adrenaline will, give you a bit of a rush, but it'll sort it out. Otherwise, you'll be like this all day. So Randall would be worried, and the adrenaline will make him jittery and his heart rate go fast, and there'll be side effects, but he's given adrenaline many, many times. So Randall has seen all the side effects from adrenaline that can happen.
Randy, I got your pedal set. Here is okay?
Yeah.
Yeah. Half a milligram, my friend.
Yeah, can't wait.
I'll get you some water. Here.
Hi. It seems to have turned off the allergic reaction he was having, so that's good. A for adrenaline, and that does the trick, yeah. But we'll watch him for a while.
While Randall recovers from his stings, he has other bee problems on his mind.
I've got like 20 kilos of honey to clean up when we get home. There's going to be honey everywhere. So it's going to be a bit of a mess.
So that's 80%.
In Trauma Bay 2, heart attack patient Matthew has dangerously low oxygen levels.
Okay, so Martin, you're going to take over?
Yeah.
The emergency team needs to take over the 55-year-old's breathing, but it's a very risky procedure.
Can I have the stool to my end, Gina?
Senior emergency doctor Martin Dutch has just seconds to put a breathing tube down Matthew's throat.
Ideally, we'd have oxygen levels at 100%. We actually stop people breathing for a period of time while we're actually placing the tube. If you've got low oxygen levels and you stop breathing, they're only going to go lower. And there's only so low that the body can cope with before Matthew's heart may stop again.
It's on a plateaued at 84. He's ventilating. It's just on the 10.
All right, we have CO2. Sats are slowly recovering. Having said that, his blood pressure was in the 200s. It's now 129, so we need to keep an eye and see. Matthew's heart can arrest again at any time. And worst case scenario is we can't actually get it back. And he doesn't get the circulation he needs to give his brain oxygen, and he could die. Do you need your drugs topped up, or you have enough?
Yeah.
Matthew, a disc jockey, had just left his local library when he collapsed from the first of many heart attacks.
The laryngoscope, whenever you're ready. We use a device called a laryngoscope, which is essentially looks like a claw on a hammer, and it has a light at the end of it. And we can lift the tongue and the jaw out of the way and put the tube in. Okay, tube over the top, please. Placing a breathing tube into a patient's lungs is a complex procedure that has a number of different stages, all of which can go life-threateningly poorly. And now 2 seconds. Just push the tube down so I can grab it. Yep, grab the bougie. Yep. The hole that's really hard to put the breathing tube in, that's the hole that we need to aim for. It's around the corner and it's in a dark place. And hopefully put the tube in that hole and do all of that while Matthew's holding his breath. And now 2 seconds. Yep, grab the bougie. Yep.
Senior emergency doctor Martin Dutch has just seconds to put a breathing tube into Matthew, who's clinging to life after multiple cardiac arrests. Matthew literally stops breathing while Dr. Martin works the tube down his throat.
The video laryngoscope allows us to make sure that our tube is tracking through Matthew's vocal cords into his windpipe. Once we've done that, we can increase the amount of oxygen that Matthew is getting. Okay, bougie out. It's all right, cup up, please. Get the bag ready to bag the patient, please. Bag the patient, please.
Up, ready to bag.
Sats a lady, 6.
All right, good. Let's secure the tube. I'm happy. Now that we've placed the breathing tube, his oxygen levels have begun to increase. He's no longer distressed, and we can really begin to rest his heart and take the strain off that heart that's having its worst day of its life.
Still have good blood pressure, maintaining Sats.
Even though we've treated the immediate life threats for Matthew, there's still a lot of challenges that he faces. The fact that potentially there's an area of his heart that's still not being supplied with oxygen because he may have had a heart attack need to be addressed.
So, ET tube looks great. His lungs are inflated. Okay, I'm happy. Thank you. I think we've done what we can for him here. Airway secure. I think we just get him straight up.
Okay.
Dr. Michelle decides Matthew is stable enough to be sent to a special heart unit.
The lab's ready.
The lab's ready. Excellent. Can we page for Gina, one of the EDAs? Thanks.
But the move can be very dangerous.
Anything can happen in transport, and it's your worst nightmare because you're out of your familiar environment. He could rearrest at any point in time. So we basically all hold our breaths until we get him onto the table and walk away. We have a arrest dose if we need to in a syringe.
Hem's coming in shortly.
Yeah.
5 o'clock. 5 o'clock, I'll team lead, and Kin is around.
Okay.
Hailing from Sheffield in the UK, Dr. Andrew Trezise joined Royal Melbourne Emergency a year ago.
Being in a big, busy tertiary centre is, it's pretty exciting. We get some interesting cases.
Signpost came up through the floor of his car. He'd literally kebabbed himself.
We see everything, really. Patients from all walks of life. Always brings its own interesting, unique challenges every time you see a new patient.
Paramedics are bringing in a young tradie with a large gash in his upper arm from an accident at work.
He's been trying to go around a colleague who was using an angle grinder with a sander attachment. Hit Stephen in the back of the arm, shoulder to elbow, just on the back. So I'm in the hospital.
Thank you. Cheers. All right, Stephen. Yeah, so my name's Andrew. I'm one of the doctors here. Bit of a day for you, hey? Yeah.
Yeah, a bit different.
Yeah, a little bit. Arm at the moment feeling okay down here?
Yeah.
Yeah, can you give me a big thumbs up and try and do an okay for me? Good stuff. All right, let's take a quick look.
It's always worth having a thought of what might I find. Any kind of limb wound, we'd always think, do we need a tourniquet just in case we take this bandage down and it starts bleeding everywhere? There's always the chance the angle grinder has actually got into the bone itself. Am I going to sort of find something that's really significant that's going to cause serious impact to this patient?
All right, so let's have a good look.
It looks like the cutter has gone most of the way down his upper arm, which is a big wound.
It's gone down probably just about to the muscle there.
Stephen's right-handed, so the wound is likely to force him out of work for a while.
As I walked past, it caught my arm.
So it sort of kicked back.
So yeah, kicked back
and just gone up like that.
Straight into my arm. Yeah.
If you have a deep enough injury, you could get a fracture in that bone. And obviously, we know that the average angle grinder is not particularly clean, so there's always the chance of introducing infection as well.
What I might do is I might just put a bit of local anaesthetic in the whole thing so that you won't be too sore.
Unfortunately for Stephen, it's going to require him to have quite a few injections.
It does sting a little bit when it first goes in.
Ow.
Once the anaesthetic starts working, it shouldn't hurt anymore.
We want to make sure the wound is nice and numb and that he's not getting any pain from it so that we can give it a good wash.
Just a couple more.
Almost there.
This side should be nice and feel a bit numb now.
Yeah, I don't feel it.
That's what we like.
Alrighty. Doing okay?
Yep.
Good man. Give this a good wash.
Definitely infections is going to be the big thing that we would worry about, particularly if the infection gets into the bone and it spreads. That can be really, really difficult to treat, and there is a small possibility that they would have to amputate the arm.
So I'll try and sort of shove this under your arm. Yeah, that's good.
In Royal Melbourne Emergency, labourer Stephen is having a large gash in his arm numbed, so it can be cleaned to stop infection.
So try and sort of give it a bit of a scrub as I go, so tell me if it's very sore.
Yep.
What we would be particularly concerned about would be fragments of things left in there. So whether it's fragments of the angle grinder, the disc itself, whatever was being cut, whether it was wood or metal or plastic or something, you can get those fragments into these kind of wounds.
Yeah, give us 5 minutes and then Mum can come in and we'll just cover it up first. Okay. All right.
Yeah, how's your mum with blood?
He's not too bad with it, but he probably doesn't want to see it.
You don't want to run the risk. It's different when it's your own son as well, I'm sure.
Yeah, exactly, yeah.
Stephen's mum, Caroline, has been waiting outside for news of her son's injury.
I'll just take a picture to put on the medical notes as well.
I was about to say, I'll take a photo for you too.
Yeah, you need a picture as well if you want one. Got to show the mates down the pub, haven't you? Just do one we've done this one.
There you go, it's gross. Yeah.
It's a little bit gross, yeah.
I've seen better though. Sorry.
We're probably all a bit weird in the emergency department. I think we probably all quite like wounds like this. Yeah, it's difficult to think why anybody would like that, but I suppose it's probably just that little bit of sort of adrenaline rush you get from it. It's not something that you get to see every day.
Wonderful. All right. Good man. So, yeah, we'll get some antibiotics into you just to cover for any infection and then get you home. Hi, Caroline. Coming in.
Stephen's mum is finally able to see him.
I've just been giving it a good clean out and washing up. We thought we'd bandage it before you came in.
Okay.
Thought you might not appreciate. It looks very dramatic, but actually it's quite a superficial injury. I think you'll need to stay in at least tonight. I'd like the plastic surgeons to probably they'll need to do an operation to just stitch it up. Just because of the depth of the wound and the size of the wound, this is probably something that's going to need an operation to fix up. Good stuff. I'll let you sit with him for now, and I'll come back and let you know when we've got an update.
Caroline arrived on the scene shortly after Stephen's accident.
Rushed round to his workplace to be told, yeah, he'd been hit with an angle grinder, I think it was, but there was quite a few people there, so I just sort of stayed a little bit out of the way. It's like if I start crying, he'll start crying, or if he starts crying, I'll start crying. So it's like, I'm just going to stay out of the way.
She's worried about her 21-year-old son's future job prospects.
Is that a permanently damaging injury, you know, like nerve damage or, you know, sort of that sort of thing, especially with sort of trade work, you know, you need your arms.
Luckily I didn't hit the artery or anything.
Yeah.
Or the muscle.
So
just missed.
Yeah, thank his lucky stars that he's all right, and I think his arm will be fine. Just left with a bit of a scar and a good story at the end of it.
In emergency, you have to switch gears very quickly from one to the next because the patients just keep on coming.
It's Gemma, one of the nurses in ED. Can I get a med pack for a traumatic arrest, please?
A big emergency team, headed by Senior Dr. Jonathan Papson, is gathering quickly to treat a man with life-threatening stab wounds.
Stab to neck that's arrested. Yeah.
We're about to receive a man who's been stabbed. He is in traumatic arrest, and it usually means someone has bled so much that there's not enough blood in their system for the heart to pump now.
Can you page an EDA?
Nurse Gemma Hodson has worked in Royal Melbourne Emergency for 9 years, and she's coordinating the trauma team, well aware of the pressures.
I've ordered it. I need an EDA.
I know straight away that I need to organise some urgent blood from our blood bank. We need to make sure that we've got blood to replace what he has lost.
Can you run upstairs, get that, take it to T2? Whew. So, yeah, just the EDA is just bringing some blood back because obviously he'll need lots. He'll probably even need a second met pack, but we'll just see how things go at the moment.
It definitely can be stressful when we are anticipating someone who's critically unwell. So our training just kicks in and we know the processes, we know what to do.
Come in now.
Yep. I'll do procedures.
I'll do airway.
This is as urgent as it gets. We need to stop the bleeding and replace the blood that's been lost. We have to act straight away to reverse what we can, and we need to get him done within 2 minutes.
So we don't know the time the injury occurred, but it wouldn't have been long. On our arrival, he was in cardiac arrest with a penetrating neck injury, a significant amount of blood surrounding his body. So we've essentially loaded him, assessed and treated en route.
So this is our puncture wound?
Yeah.
This gentleman has a penetrating neck injury. It's gone into all the deep structures, it's gone in deep and it's hit something.
It's not 1 centimetre. On the neck? On the neck. Left. There may be other injuries you haven't seen. Yeah.
Neck's full of blood vessels. So the first thing we need to do is to stop any obvious bleeding, put pressure on it.
It's only small. It's very, very deep.
While the patient gets oxygen, Dr. Papson needs to make a small incision into his chest to release any built-up pressure.
Potentially the cause of his arrest is air in the wrong place around the lungs, compressing the lungs, making the lungs unable to expand. That can kill you. So we need to reverse that by cutting the chest open to let the air out of the wrong spot.
Left side's still compressed.
We don't know anything about this gentleman. We don't know his name, age, date of birth, anything. Police attended, he was found unconscious. They commenced CPR in 4 minutes. Assessment revealed asystolic.
That's the heart sink moment, because when you're asystolic after a penetrating injury, it means your heart's actually stopped.
He's got no pulse. He's got no pulse.
Senior Dr. Jonathan Papson and his team are desperately trying to revive a man who's been stabbed in the neck.
It looks like he's bled out. We have only minutes to save this man if we can.
We got access or not?
No.
I'll just drill in. I'll just put an IO in. Yeah.
When people bleed a lot, their veins collapse and it's harder to get access. So I need to drill into the hollow part in the middle of the bone and we can pump blood into there. I only do it in the most extreme emergencies.
IO's in. You got some blood, please?
Still in asystole.
The team is running out of options.
We use our ultrasound to show us, as a last resort, is there anything else we can do? Is there a surgical option we can take?
What are you seeing, Adam?
Nothing.
Ain't no harm.
The ultrasound has shown us that he's asystolic. His heart's not beating.
We've got no breathing. We've got no pulses. We've got cardiac standstill.
And it's been how long?
20 minutes.
So it's the worst outcome.
I'm happy to call.
Yeah.
Okay. Anyone have any issues? No. Okay, I think we'll leave him in peace.
Yeah.
Okay.
It's an awful tragedy that this has happened. We tried everything. There's nothing further we can do that will help bring this guy back.
I'll just tell that side to sort of keep their curtains closed and get...
Gemma Hodson and her fellow nurses will watch over and care for the patient until he is transferred out of the emergency department.
12:05.
Thank you.
That's all right. I think in any circumstance where someone has passed away, especially in tragic circumstances, your thoughts are always with their family and friends and loved ones.
Are you all good?
Yeah. It never really gets any easier, but we get better at managing sort of how we feel about it. That's not to say that some days we might have a cry. We do see death on a regular basis. But we're never shamed if we show emotion.
First baby?
Yeah. Just worried about you.
Expectant parents Larissa and Jake were in a car crash and rushed to the emergency department.
The result of that scan came back and it does look like you've got some fractures around that bone that surrounds the eye.
Jake had surgery to repair the damage to his eye. And after a night in hospital, Larissa and baby were sent home with a clean bill of health.
All right, let's take a quick look.
Labourer Stephen's gash from an angle grinder needed dozens of stitches. He was discharged 2 days after his operation and soon after was given the all clear to return to work.
How long ago did you get there?
45 minutes ago.
Senior nurse Randall came to emergency on his day off with multiple stings from his honeybees.
So you're covered in an urticarial rash.
Yeah.
Randall recovered and thanked his friend and colleague Dr. Jonathan with a special gift.
I actually got a tub of honey from Randall when he came back to work, so that was good. The honey was good. Doing a good job there. Although we would advise against keeping bees if you've got an allergy to bees, but the honey was good.
You're okay, mate. Just relax, arms down.
DJ Matthew was found unconscious in the street and his heart stopped multiple times on the way to emergency.
Tim has the drugs for intubation.
Doctors battled to keep him alive with a breathing tube so he could be sent for surgery. Defying all the odds, Matthew survived and is grateful to everyone who helped him.
I am very lucky. I had these wonderful angels around me, like the nurses and the doctors. So many people were involved. So thankful for all the work that the Royal Melbourne staff put into their keeping me alive, and I really appreciate it.
For Dr. Michelle, Matthew's recovery is the greatest reward.
It feels really satisfying to know that he came in on what was the brink of death, and we were able to literally save his life.
Surgeons put a stent in Matthew's heart, and with regular medication, he has a new lease on life.
I feel alive, I'm happy. I feel that I can do anything, but I slowly